In a land surrounded by water, there is little water safe enough to drink, clean enough to wash hands with, and ample enough to flush human waste away. Such is the irony of the province of Masbate, composed of the islands of Masbate, Ticao, and Burias. This province in the center of the Philippines carries the burden of giving potable drinking and household water for over 800,000 people.
Yan ang pinaka-challenge dito. Mahigit ng ilang dekada, tubig pa rin ang pinaka-problema dito sa aming lugar.
Without water in their own homes, residents walk for 15 to 20 minutes through uneven paths just to get water for their daily needs.
Yung tubig po namin, kinukuha namin po sa balon. May dadaanan pa po kaming sapa.
Without clean drinking water, people get sick with diarrhea, or worse, cholera. In 2009, a cholera outbreak hit the town of Montreal, affecting children and adults alike.
Umabot din yung mga pasyente, umabot din ng 100 plus. Wala na silang malay na nadating, kaya pagdating talagang saksak na kami agad ng IV.
Without access to water, people also find no reason to have their own toilets.
Sa bukid sila, baral to bukid una nga ato may malibang na gabi bay-bay ko may kapalit og grang CR kay lisod man kasanan.
Without water, children do not get into the habit of washing their hands.
Ang mahirap po sa pagtuturo sa mga pupils, wala po kasi ditong flowing water.
Clean water, clean toilets, clean hands. These have been proven to be effective in saving lives of children. Research showed that out of 10 cases of diarrhea in children, half could have been prevented if children washed their hands with soap and water. Out of 10, 4 children did not need to suffer if the water they drank was boiled or treated with water purifying tablets. Out of 10, 4 children would also have been spared if they only had better toilets. Local leaders in Masbate know this fully well. With the help of partners like the Department of Health, UNICEF, and World Bank, Masbate is taking on the challenge, one family and community at a time. The practice of drinking safe water, toilet use, and hand washing should start in children as early as possible.
Bago kumain, pagkatapos po mag-CR.
Water, sanitation, hygiene, or simply wash refers to an integrated approach to prevent diseases and deaths, especially among children, through clean water, clean toilets, and clean hands. In villages where most people dump their human waste in fields and waterways, local leaders and volunteers get residents to see and smell how horrid human waste is through a strategy called Community-Led Total Sanitation, or CLTS.
Kinukuha namin yung tae, pagtatabihin namin yung pagkain sa yung tae. Yung langaw yung dadala ng sakit. Pagdapon niya sa pagkain, galing niya sa tae.
Seeing and smelling human feces becomes a visceral experience that most mothers and fathers quickly get convinced about having their own toilets for their families. Standing face to face with human feces makes them see that both direct and indirect contact with feces may contaminate the food they eat. It triggers disgust or shame around the risk of eating other people's waste. These feelings usually lead to collective community action. But to make people understand the importance of water, sanitation, and hygiene, they have to see that rules are in place. Leaders walk the talk, and risks and benefits are properly communicated.
Sana gayahin nyo. Mahirap magsimula, pero pag nasimulan na, tuloy-tuloy na ho yun.
Ako kami sir, salamat og naamagin tayo maabot nga hinabang sa among kalisod.
So pangunahin po naming pangangailangan ay ang kakulangan namin sa CR, kakulangan din namin sa tubig na mapagkukuhanan ng magagamit namin sa mga CR na ito.
Matahom ko naghuhugas ng kamot tapos ang mga kuko.
Sana we may be able to sustain that change of attitude of our constituents.
And this wish list may go on and on. Though their wishes have not yet been fully realized, we can see clearly that life grows where even little water flows.